Hello, everyone. Welcome to my channel. It's Rafael Gutierrez, and today I'm going to talk a little bit about, pretty much news that's going on and different things and why people are making certain mistakes versus why someone may actually want to follow certain ideas. First, I'm going to tell you two stories. One is actually two scenarios. One of them is a story, actually case presentation I read when I was in med school, and I can't remember where I read it or what it was about, but it was pretty much a health practitioner was treating his son for asthma. And what he would do is he'd treat him with asthma medication, symptoms would improve, and then a week later they'd become worse. And so he ended up giving steroids, symptoms would get better, then worse again. So he gave them higher dose of steroids and continuous, until one point he takes them to emergency room, unable to breathe. And when he is unable to breathe, the article I was reading talked about a resident from South America who saw the kid and without blinking said, "We need to set him up for surgery. We need to do x-rays to find out, imaging to find out where the parasite is. He doesn't have asthma, he has a parasite." And sure enough, they did the imaging and they found that he had a parasite and he needed surgery to get rid of all the parasites that were in there that hadn't been treated. They could no longer be treated by medicine. The idea behind that is this: a lot of times people start treating symptoms rather than the cause. Another example would be if, I can't remember where I heard this, but imagine if your smoke alarm's going off. It's driving you crazy. So you go in, take off the batteries. I think it was John Oliver made a comment. Take it off, put it back in, go back to sleep, and don't pay attention to the fire in your kitchen. Well, yes, you stopped that, but you're still going to die in a fire. And so the thing is, you need to be able to pretty much look at what the disease is and treat that, not just the symptoms. If you treat the symptoms, you are going to end up just making the disease worse if you don't treat the underlying cause. Now, let's talk about what some people are protesting right now. The economy is crashing because there's no, people aren't working. Well, the cause of the economy going down is not people not working, it's the disease that is actually coming and playing a role in our lives right now. Now, I will tell you, on April 3rd, the AMA actually sent a letter to the governor, pretty much every governor, and in it they said the physical distancing is the only effective mechanism to slow the exponential spread of the virus and decrease the anticipated spike of COVID-19 cases across the state. What they're actually saying is, at least in April 3rd, 18 days ago, that pretty much we have not seen the spike of cases yet. They're actually expecting a higher level of COVID-19 cases than what we have right now. At the same time, one of the things that's happening is our healthcare professionals are becoming more and more exhausted. There's a video I really like. It's a surgeon who talks about what's going on, and you can see by the way he speaks that he is just frustrated having to deal with people getting sick and not being able to have time to fix themselves. Now, a lot of times people say stuff and they don't understand exactly what's going on. And so I'm going to give you a couple different things to let you understand why social distancing is important. First has to do with something called infectious dose. For a virus to actually cause an infection, you have to have a certain number of that virus come into you. Now, if you have that certain number of that virus come into you, you're going to get that disease. If you don't have it, you might not get sick. There are cases why you may not have the infectious dose at the high enough level, and yet you still get the disease. But that's actually one of the big things that ends up happening is you need a certain amount of virus to get into you so you actually get the disease. So COVID-19. Now, if you go outside, your chance, if you don't have the coronavirus in your house and you go outside where the coronavirus will be, you will be exposed to coronavirus. Maybe low enough that it won't be enough for an infection, but you will be exposed to it. Now, a lot of people say, well, I'm just going to wear protection. And the best masks that most people are actually talking about are the N95. Thing with the N95 is for it to actually work properly, it has to be fitted to your face. If it's not fitted to your face, it actually will have openings where virus can actually come in there. On top of that, Even the best mask has pores to allow air to come in. I will tell you, I did look at the pore size of the N95 and found that it had a pore size roughly zero 0.3 micrometers. It's small, and most things will not be able to go through there. But the COVID-19 virus, the coronavirus, is actually 0.1, 0.12 micrometers. So it's actually almost 3 times smaller than the pores. So I'm not saying that the masks don't work. I'm not even saying that the any barrier that you put in front of you doesn't work. It will prevent something. But the best way to think about it is think of going out into rain with the umbrella with a hole in it. Are you going to get wet? Maybe depending on how big the hole and if the water goes on there as easy. But if the hole isn't big enough, if the hole is there is a chance of getting wet if there is a rain. So if you're wearing even the best masks available, you can still get the virus because the pore size is actually 3 times larger than the virus. It will give you some protection, yes, but it won't be as much as keeping your distance away from someone. So, big thing that is happening, just to go into it, we actually do have a disease. It's the virus causing COVID-19. This is actually what's causing the economy to actually suffer. Now, if you try to fix the economy without fixing the virus, it's doomed to fail. There's just no way to put it any other way. You try to fix the economy without fixing the virus, it'd be like, I don't know, shoot, everything I could think of is R-rated, so I won't say that. But it would be like going to an area enclosed with flu wearing a little paper towel and thinking, hey, I'm not going to catch anything. Well, yes, if you're actually involved, if you are exposing yourself to virus, you are going to get the virus. If you don't treat the virus, if you don't treat the cause of the disease, the symptoms are just going to get worse and worse. You can't think, oh, well, we're just going to treat the symptoms and not expect everything to go right. We have to actually treat the underlying cause. In this case, it is the disease. And the best way, according to anyone in public health, any nurses, anyone with any medical training whatsoever, is going to be to keep 6 feet away from anyone. So if you think, oh, well, I'm going to save the economy by protesting in front of a building right next to someone, well, you're pretty much just going to get yourself sick. You can get your grandparents sick. And let's not forget, infants, newborns do not have immune systems well developed, so you can actually kill a lot of babies. So this is just information. If you don't like it, well, it doesn't mean that it's wrong. It's just what is. I would actually also tell you, because there's actually some people who continue talking about, oh, well, there's these miracle drugs we can take. About those miracle drugs, remember, every doctor will tell you any drug will have side effects. And some of these drugs have really serious side effects. If you actually look at some of the anti-malaria drugs, they can actually stop your heart. They can actually affect your kidneys, your liver. They can cause you to go blind. These are not things you want to take if you don't need to. So again, I would actually tell you, go to PubMed and Google the side effects of any medication that's being pushed to you as a miracle cure, because you'll see some of the stuff in there you don't want. Please stay safe. Please remember that we are all in this together, and we should actually be uniting using real data, real information, and listening to groups like the AMA and public health institutions and Dr. Fauci, which I think that very few people will actually say this is someone who we shouldn't be listening. I think everyone who actually studies medicine, studies epidemiology, studies will look at Fauci and say this is who we need to be following right now. I hope you enjoy this and that you found something useful. If you do enjoy it, please feel free to share. If you're interested in other videos, please do that. And please stay safe. Have a nice day.